let's do a lip enhancement on Nicole, and we will describe what we're going to do. We're going to make Nicole famous here. Let me tell you what her treatment plan is, because a lot of times, you know, we show a lot of treatment, but you really don't know the plan. So Nicole is 24, has never had Botox or dermal fillers or PDO threads before, and she doesn't really need much. And so what we are going to do here, just turn towards me a little bit. You can take a look and see that she's got some skin texture problems right here. And those we're going to address with smooth PDO solid filler threads. And that's really going to help the skin texture here. It's going to help some of these acne scars. She's got them on both sides, as you see. So that's number one part of the treatment plan that we have for her. Number two, and you can see this, and certainly in her full face pictures, she's a little deficient in the cheek area, you know, even at her young age, naturally. So later on, we may come back with filler up in here, but we are going to get some of the collagen buildup as we go over this area with the solid filler smooth PDO threads. So that's part of what we're thinking about in terms of what we are going to do for Nicole as well. And then turn back, and we'll do that on both sides of Nicole's face here. But now let's concentrate on her lips. No nasolabial fold. She's got good volume everywhere here because she is nice and young. She doesn't really have any issues that we're going to address with any kind of botulinum toxin. But here with her lips, she's already got some really, really nice lips here. And, you know, she's got some nice anatomy, but she does have some volume deficiency, definitely in the lower lip. So we're probably going to start there, and then we'll go back up and give her a little bit of fuller lips. As we were talking, she doesn't want these gigantic lips. And give us a big smile here, Nicole, too. Now, this is always important. We want to make sure to know where her smile is before we do any kind of lip filler enhancement here. And just relax again. And then, because we want to make sure, we're going to give her a really good lip filler enhancement, where we're going to place that filler in the proper place, so that when she does go into a big smile again, once the lips are filled, then we know that her lip lines and smile lines will be enhanced and will be correct. And that's an important thing of the way we teach this in the AAFE. But that's going to be our plan. So it's going to be some skin texture issues that we're going to do with solid filler smooth PDO threads. That's also going to build volume on this side of the face, on this side of the face. And then we're going to do a really nice lip enhancement for her. Now, in talking to her, she doesn't want the huge Hollywood lips, but she does want some oomph to those lips. And that's exactly what we're going to provide for her. So you'll see that in some of the upcoming videos of her treatment. Okay, here we go. And she has got some anesthetic cream on her cheeks, because we are going to go ahead and do some we're going to do some PDO smooth threads on her cheeks here. But what we're doing now is we are going to enhance the bottom lip first and really take a look at it. Just go side to side, keep adding structure and volume as we go across the lip. And it's really a step-by-step. And it's really something that all of you can be trained to do very well. And you need to have a plan as you're going across here. So as you can see, we're just going to add volume. Now, we add volume at different depths. We add volume in different places between the wet-dry line and the vermilion border in order to go ahead and, depending on the patient's needs, give her the best enhancement available. But we really want to bring out that pout, that gorgeous pout that she has. She's got some good anatomy there already. Now we're going to go ahead to the upper lip, and we're going to, again, apply the same AAFE principles. We want to give her a great upper lip enhancement, but we don't want to hide those teeth. So again, placement is very, very critical no matter who is doing this for you. And you want to stay sometimes a little bit deeper, sometimes a little bit more, a little bit more shallow here. And we can also enhance the Cupid's bow, and that's what we're doing right there. And then we are even going to go back and really enhance the philtrum on this patient as well. And that's going to look really, really pretty on her. I mean, it's perfect for her. And some of them like a really, really defined philtrum, and she's absolutely perfect that. We're going to smooth everything out so that we don't feel any lumps or bumps, and everything is nice and even here. Now we're going to go to outline those vermilion borders with these gorgeous, gorgeous smooth filler PDO threads. And what that's going to do is pop out the lip border between the skin and the lip part of the lip border, as you can see. And look, you'll just see when we take these out, they are just going to be gorgeous. That nice, sharp, crisp border is what we really want. And here's what it looks like if once before we go ahead and take it out here. And you can really see close up what that is. And it's right in that border. And now we're going to twist and turn and take that out. And here you can see the final result here. And we'll get a little bit closer and you can see beautiful lip enhancement with fillers and PDO threads. Yeah, isn't that great?
Yeah.
Are you numb, Nicole?
Yes.
Like super numb.
Yes.
Right. That looks really good. Those are really pretty on you. Did a great job. Ashley did a great job. This is all Ashley. Ashley did a great job.
Good job, Ashley.
There it is. Isn't that great? Okay, good. Give me a big smile to the camera. Let's take a look. See? And that's the important thing too. Just lean your head back just for a second there, Nicole. But you can't stop looking at her lips. Give me a big smile right there. Really important when you do a lip enhancement that you don't hide the upper teeth. And that is part of the AAFE protocol to get them these beautiful lips. And just go to rest again. Okay, and make sure that they're nice and pouty and really nice, but when they go into a big smile, that they don't hide the teeth. Now we are going to go ahead and show you a solid filler PDO thread placement, and these are going to be smooth threads. First thing you want to do is you've got to know your treatment plan, and so you'll learn how to make a pattern on the patient's face depending on the skin area that you want to cover because of skin texture issues, and also we want to add collagen over the long term and get her a cheek enhancement here. So now let's go to placement. You've got to be in the right plane for this to be comfortable and also to get the maximum effect. Two things are going to happen here. We are going to get long-term collagen production, and we are going to get an immediate visible result just by the placement of these threads, which are going to give a structure to the skin which you didn't have before, and immediately you're going to see a result. Now, depending on the situation, you may go from the bottom up here or from the top down. This side, we want it to go from the bottom up. We're going to get a cheek enhancement, but you'll see what we do on the other side here. But placing them, very simple, very quick. Turn, and then you pull these out. Here's what it looks like before we go ahead and remove them there. Now let's go to the other side, and here we're going to place it a little bit differently, and this comes with getting trained correctly. You want to make sure you're well trained. So because there's a plan and there's a technique to placing these, not just in the direction in the right plane, but how you're going to place these to get the maximum effect that you want. And again, on this side, we need even a little bit more of a cheek enhancement, and that's why we are going to place these from the top down as you go ahead and see here. So, it's a great, easy technique once you're well trained, and that's the key for all of these things. We thought, again, we could get another one in here, and you'll see the last one doesn't go quite to place, so we just pull it out, disregard that. We don't need that one at all here. Now you're going to twist and pull all these out, and they will immediately give a structure to it. Clean the patient all up so we can go ahead and see what this looks like, and she can see what it looks like here on. Okay, Nicole survived. She did really great. So now let me just show you. This is after our first treatment. She's got now these gorgeous lips that are a little bit swollen, but just a little bit. And we tell them don't touch your lips at all because just natural movements and whatever she does over the course of the next day or two will really distribute this filler exactly where we want it to go. So that's the first thing that we have. She's got now these beautiful philtrums. She has got threads that really popped out the vermilion borders, and she is in love with her lips. Are you in love with your lips?
Yes.
I don't want to put words in your mouth here.
I love them.
Yeah, they're really, really great. Now, we also did a lot of smooth, solid filler PDO thread, so you can see where she's a little bit red there, but immediately it's already improved the texture of her skin. Just turn towards me a little bit. And she feels that too, and she loves that, and also going to build up these cheeks. So we'll see her in a month, and we'll continue on with her treatment.